What's up, guys? I'm just trying to make a quick update here. A lot of things have happened this week. I don't know where I left off, but I had my 4th chemo last week, and I ended up. It beat me up pretty good. I had a hard time eating it all. That usual day of chemo with the steroids. That didn't happen. I didn't get that boost from the steroids that wanted to make me eat. It just, I was just nothing, couldn't eat. So I ended up I lost quite a bit of weight. In fact, on Friday of last week, well, let me start by this. Today is September 6th, Wednesday. So on Friday of last week, I ended up, I went in for my radiation treatment, and I had to call the doctor because my mask doesn't fit me any longer properly, and they're concerned about the amount of radiation that I'm getting at this point, being that my neck has shrunk quite a bit. I have a lot of redness and skin discoloration on both sides. I have some sores in my mouth and naturally a sore throat. But the weight loss was considerable. About 15 pounds I think I was at as of last week. So they did what they call a planning scan, not a planning scan, an evaluation scan, to see the location of the tumor, size of the tumor, and what they need to do, if they need to change the angles or the amount of radiation. So basically, they did that on Friday, and then I went home for the holiday. I ate pretty good Saturday. I actually had an Italian hoagie on Saturday, a foot-long Italian hoagie. I only ate 6-inch, and then I ate the other 6 inches on Saturday. I'm sorry, on Sunday. Over the weekend, I had some stuffed shells, Asiago cheese stuffed shells, thanks to Rose, my girlfriend, and she made me. She heated up 4 of them. I only was able to eat 3, but 3 was considerable. I had cereal for breakfast both days, a 400-calorie chocolate milk, and then on Labor Day I had some party sides, potato salad, macaroni salad, some roasted potatoes, and baked beans. It was a decent meal, nothing spectacular, but some food. So then I drove back Monday night, and Tuesday was my scheduled 5th chemo. So I woke up in the morning, I made myself, believe it or not, an egg omelet, Cooper Sharp cheese, 2 eggs. I had that omelet, and it went down okay. I had to kind of force it. It didn't taste real good, but I forced it down. I drank about 16 ounces of water in the morning before I even went to the hospital, before I went to breakfast. And then I had some water on the way to the hospital. So then I get to the hospital, and I go to get my labs. That's the first thing they do, is give you your labs. I went to get my labs, and a girl called me in. I went in, I sat down in the chair. She took my blood pressure, and my blood pressure was like 85 over 54, something like that. And she asked me if I was feeling okay, and no. Immediately at that point, I noticed that my vision was messed up. I had like tunnel vision. I had halos over my eyes, and she immediately went and called my nurse oncologist. Nurse oncologist told her to get a wheelchair. They put me in a wheelchair. They took me up to the 3rd floor, and after sitting for a little while, they took me in and they gave me an IV with 2 bags of fluid. my nurse oncologist came up and explained to me that my blood pressure is very low. Most of my blood counts are okay, even after 4 rounds of chemo. My red and white blood counts are low, but that's not abnormal after chemo. The concern right now is my blood pressure. And as of yesterday, my nurse oncologist told me she's not giving me any more chemo. At least not now. Maybe not at all. It's going to be a wait and see what happens kind of deal. So they gave me the 2 bags of fluid, and I drove back to the lodge last night, and I was fine. No big issues. This morning, I ordered a pizza last night from Domino's. A thick crust pan pizza, extra cheese, diced tomatoes, onions and mushrooms on half. And I ate 2 pieces. They were about 380 calories a piece. So I ate them last night. Even with the sores in my mouth and my throat, I was able to get it down. And they tell you to stay away from acidic foods, and I was still able to get it down. Drank plenty of water last night. I had Pedialyte. I woke up this morning. I made myself breakfast. I had scrambled eggs, 2 eggs scrambled, and I made French toast, but I was only able to eat about half of one French toast. I ate all the eggs. I had a cup of milk with a little bit of protein powder in it. I didn't want a full protein shake, so I just had a little bit of protein powder in it. I had, again, about 16 ounces of water before I went to breakfast today. And then I drank some water on my way to the hospital. Got to the hospital. Was meeting with Dr. Lukens today to discuss everything, and turns out that I get in there, I sit down, she takes my pressure. My pressure's low again. Not pass out low, but close to it. I was starting to get the halos again. Told her about it. The girl went and got me some apple juice and some water. I drank that while I was waiting for the doctors to come in. They were debating on whether or not they wanted to give me more fluids again today. I'm scheduled by my nurse oncologist to have fluids tomorrow. So after sitting there for a while, drinking water, drinking the apple juice, my levels kind of came up. So I went over everything with Dr. Lukens as far as my treatment goes. He showed me my evaluation scan, and lo and behold, the tumor has shrunk quite a bit. If you can imagine looking at 2 straight lines down the side for your throat, back in July, the one side, which is this side, had a bump out in it, like that. And it was visible in that straight alley. He showed me that before, and now he showed me the after of last week's Friday scan. And there's no more bump out there. That throat is straight up and down. So the tumor has shrunk, which is good. He told me that the planning scan, in reference to the evaluation scan, has changed the amount of radiation that I'm going to get. They're going to lighten it up a little bit because I have lost so much weight, and my skin is starting to burn a lot. He told me that basically I've been getting, up until now, the same amount of radiation I was getting when I was heavier, and now a lot of that's absorbed by the skin, and it's unnecessary. So they were finishing up the plan today. He said either tomorrow or the next day I'll start that new plan, less radiation. He told me that everything is going the way it should be. And yesterday when I was at the nurse oncologist, or when I went to get my labs, the first thing they did was weigh me, and I weighed 142 pounds. Now I started this at 170. and I was surprised that I lost that much. Needless to say, I talked to the nurse oncologist, and she was shocked that I lost that much in the last 3 weeks. 27 pounds is a lot of weight to lose. So she set me up for a feeding tube. I have an appointment tomorrow for consultation, and next week will be the surgery to install the feeding tube. It sucks because I only have 2 more weeks left of this, and I don't even know if I'm going to get chemo anymore. I really don't want to have the surgery and open up the possibility for a feeding tube and so on and so forth. But anyway, they say that the radiation will continue to work even after I stop treatment, and the side effects from the chemo don't stop when you stop chemo. It'll carry on. So therefore, I may still have problems eating over the next 2 months. I don't know. But she said if I lose any more weight, I'm going to end up in the hospital. And that's not good. So, with that said, I talked to Dr. Lukens about it today, and I explained to him, I said, I'm shocked because, I said when I came here today, yesterday my weight, I was 142 pounds. I went on the scale just now, and when she weighed me, and I was 153 pounds. I mean, I know those 2 pieces of pizza were pretty packed, but I still can't believe. And then he looked at the history of my weight, and he has now determined that 142 pounds yesterday was a miscalibrated scale. And he says that chances are it wasn't 142 yesterday, because there's no way, no matter what I ate, that I'd be 153 today. So, at this point, I may be able to stave off that feeding tube after all. I'm going to try. I just went shopping and bought some stuff. They told me to try and eat more salt, which I haven't really done much of. I mean, like I said, most of the stuff I've been eating was dairy products and so on and so forth. But I need to try to pick up my blood pressure. I need to eat more generally, but I need to try and get more salty foods into my diet. And then naturally I have to continue to hydrate and get the fluids tomorrow. But other than that, I do have more soreness in my mouth because of the sores that I have. I feel more swelling from the radiation than I did before. And we're getting there. Today I should have had 11 treatments left. He said now with the replanning of the scans, I'm only going to have 10 more radiation treatments left. So I'm almost there. I also discussed the fact that I got 4 chemos in, and my original oncologist told me that 5 is the magic number that we really need to get to. I asked him his thoughts on it, and he said, well, it's up to Beth, but if the reason they want you to get 5 treatments of chemo, of cisplatin, is they're 40 milligram treatments, and all the case studies and all the trials point to, I guess, 200 milligrams, I believe, of cisplatin with radio chemo, and that's the standard. So 5, I get 40 milligrams, so 5 times 40 is 200 milligrams. That's the standard. Now, he said that's not to say that the 4 treatments that I've already had didn't do anything and aren't helpful. He basically said that he's had people before that, don't do the full 5 or 7, and they turn out okay. But the baseline is 5. He said he'd like to see me get 1 more. It doesn't have to be consecutive to the other ones, so if my pressure and everything turns around in the next 2 weeks and we can have it at the end, then so be it. Not that I want another one, but I really don't want to leave anything to chance. So I'm going to have to think about it and discuss it with my nurse oncologist and basically see how I feel. The risks are high with cisplatin. You have a chance of going deaf. increased chance of strokes, increased chance of, I even saw an article I read, you could lose your vision in your eyes. I mean, one eye, two eyes, both eyes, you can go blind. It's not a joke. It's rare, but it happens. So, I'm not a big fan of the chemo. It's really beat me up. That is the reason why I haven't eaten. It's not the radiation. I've been able to force food down. It's the not being able to, or not wanting to eat is the problem. It's horrible. And they say there's a 10% improvement with cisplatin for my particular head and neck cancer, which is not a great, outlook. And the risks are very, very high for that 10%. But I'm not here to advise anybody on what they should do or shouldn't do. I made the choice to try it. I made the choice to do as many as I can. And if 5's the magic number and I can get through it, I'll try it. But we're going to wait and see. I can't feel the way I do. I can't have my blood pressure dropping and feeling like I'm going to pass out or losing my vision or anything like that. So I need to decide what I'm going to do, but not today. We can wait until next week or whenever. My main concern is getting my weight back up. Needless to say, so the scale was off yesterday and I was 153 today. So I'm still not happy with that weight. I know I need to at least stabilize it, if not build it up. But it's better than 142. And as I said, maybe I can stave off this this feeding tube they got me scheduled for next week. I'm doing everything I can in my power to get through this without having to disrupt anyone else's lives. Still driving to and from the hospital every day. That pressure thing yesterday scared me a little bit, so I'm going to up the salt intake and I'm just going to try and take care of myself. It's also 95, 96 degrees outside, and it's pretty unbearable right now. So I'm not walking outside or anything like that. I spend most of my time in the car, then into the hospital, and then back into the lodge, and it's all air conditioned. So it's important that I keep from sweating and burning calories and salt and fluids. So, all right, that's enough talking for today. My throat's really sore, and I really shouldn't even have talked that much. But just wanted to give you the update and let you know where I stand. And as I have told you before, I'm not Superman. This is tough. God bless you if you're going through it. I have a new respect for. It's not that I didn't respect him before, but you never really understand until you actually go through this, what it's like. And my heart goes out to everybody out there that has cancer. It's very sad, especially when you see children there for radiation. It's very sad. All right, I gotta go. I'll keep you posted. Peace out.